Kawasaki disease is an acute systemic vasculitis that may last for 12 days on average without medical intervention. Typical symptoms include high fever, red tongue, red swollen feet and hands, rashing involving much of the body. Intravenous immunoglobulin, aspirin, steroids are the common recommended drug. Long-term complications can severely affect the coronary artery and heart of the patient. Aspirin therapy in Kawasaki disease is mainly as additional treatment along with IVIG. Its effect is still undeniably positive during and after the onset of Kawasaki disease. Low dose at first to reduce blood clots. With anti-inflammatory effects, high dose of aspirin is given for swelling, fever, and pain relief.
Aspirin's mechanism of action. Cyclooxygenase, or COX enzyme, is a key enzyme that synthesizes prostaglandins and thromboxane A2 from arachidonic acid. Aspirin acetylates COX enzyme irreversibly, a process that inactivates the enzyme as demonstrated below. COX enzyme synthesizes prostaglandin H2 or PGH2 from arachidonic acid. PGH2 is a precursor of thromboxane A2 and prostacyclin, both of which control vasoactivity and platelet aggregation. When aspirin is in contact with COX enzyme, its ester group, right here, is attached permanently to COX enzyme's catalytic site, serine 529, right here as shown in the diagram, blocking the enzyme from interacting with other substrate such as arachidonic acid. Aspirin, now without its ester group, becomes salicylic acid, which is then metabolized by cytochrome P450 in the liver. By blocking the formation of PGH2, aspirin effectively reduces coagulation activity of blood in the body. This anticoagulation prevents vessel clots such as coronary aneurysm, a complication of Kawasaki disease. Also anti-inflammatory effect that would counteract inflamed blood vessels in Kawasaki disease.
Okay, let's look at the evidence of aspirin's clinical usage for Kawasaki disease. In 2012, a study was conducted across 74 hospitals in Japan with 248 patients with Kawasaki disease. It was randomized, blinded, and generated a p-value of 0.0034, making it statistically valid. It indicated that aspirin with IVIG and prednisolone decreased coronary artery dysfunction by 20% and reduced overall arterial inflammation. In 2010, a study that looked at cohort and double-blinded studies combined with over 100 patients had a p-value of 0.001, making it statistically valid, indicated that prednisolone served no purpose in reducing coronary abnormalities, whereas IVIG and aspirin combined did. Another clinical analysis in 2015 corroborated this data, indicating that IVIG and aspirin combined reduced coronary complications by 25%. All of these studies combined indicate that aspirin, combined with other complementary therapies like IVIG and prednisolone, decrease the presence of cardiovascular abnormalities and arterial inflammation.
Whilst the use of aspirin at a generally high dosage is considered to be a relatively safe and effective treatment of Kawasaki's disease, there is currently a more efficacious solution. The effectiveness of administering 2 grams per kilogram of body weight of intravenous gamma globulin alone or in combination with a moderate to high dose of aspirin has been well established in multiple studies. In most cases, intravenous gamma globulin or IVIG will be administered first along with a moderate to high dosage of aspirin. However, if the patient has complications with IVIG or it is simply not providing the intended response, corticosteroids can be administered. Whilst the long-term side effects are still unknown, there is current research that proves the efficacy of steroids as a treatment for Kawasaki's disease, but only in its acute phases.
Prior to intravenous immunoglobulin, the only drug used to treat Kawasaki disease was aspirin. The affordability of the drug combined with the effectiveness of treating Kawasaki disease relative to the success rate prior to the introduction of dual therapies had a major impact. Acting as a pain reliever and anti-inflammatory drug, it aided in reducing high temperatures within the body, reducing swelling, and acted as an antiplatelet. While many scientists question the effectiveness of aspirin without intravenous immunoglobulin, the overall effectiveness of reducing inflammation combined with its affordability makes it an ideal treatment in the 1950s where individuals had no proper treatment.